Hello and welcome. My name is Joe Macbeth and I am the Chief Executive Officer at the National Alliance for Direct Support Professionals. And thank you for joining us on today's very important webinar. We have 1,000 people on this webinar. Actually, some people are on hold and will be able to only listen to the recorded, archived version of this webinar at a later time. But rest assured, this webinar will be recorded, it will be archived, and we will put it on our YouTube channel at NADSP, and we will also post it on our website and our social media platforms, particularly Facebook. Obviously, we are very concerned about the spread of the novel COVID-19 virus and the impact that it will have on the direct support workforce across the United States and Canada, and potentially the people that they support who may be at a higher risk of getting the virus. Our attempt today is to share factual information from NADSP's medical advisor, Dr. Rick Rader, who we're so happy and thankful to have him here to join us today. Once again, DSPs are at the forefront of this epidemic. Not unlike other disasters, the natural disasters and weather-related disasters like fires and hurricanes and tornadoes, the direct support workforce will be tested. And it is our opportunity to show the healthcare field and society the value of the direct support workforce and the important roles that we play every day in supporting people with disabilities. So with that, I would like to welcome Dr. Rick Rader. Rick, take it away.
Why did the NADSP decide that DSPs needed and deserved a webinar specifically aimed at DSPs and the coronavirus? There are abundance of articles, reports, guidelines, seminars, and precautions on the coronavirus from hundreds of sources. The NADSP, more than anyone, understands and appreciates the unique role of DSPs and wanted to provide you with information that you could use tomorrow on how to better understand the basics of this virus and how to use your knowledge, skills, and experiences in protecting yourselves, your families, and of course the individuals you have committed to support, protect, and embrace. We wanted to provide you with reality, with facts as we know them, and to support you are needing to gain the confidence to get through this, just as we have gotten through everything together in the past. DSPs are no strangers to being an important part of the delivery of healthcare to individuals with intellectual and developmental disabilities living in the community. The goal of this webinar is not to teach you how to participate in healthcare delivery. You already know that, but to understand how that delivery might be restructured or reconsidered with what we currently know about this recently recognized virus. This slide is both a reminder of the various roles that DSPs play in healthcare matters, but also as a tribute and an appreciation from the disability community. Certainly, you have basically identified yourself as valuable escorts to medical appointments, interpreting information from the doctor and possibly translating symptoms and concerns from the patient to the doctor. Observation of symptoms are very, very important, and the DSPs excel at that, especially early observations of symptoms that might be unnoticed to somebody else. Medication administration is very, very important, making sure that the proper dosage is followed and proper side effects are also monitored. Counseling supports and education are not well known to the community, but that's exactly what DSPs do in terms of healthcare concerns, translating information, explaining treatments, explaining the prognosis. Those are things that are very, very important. Prevention, maintaining prevention in group homes, in the workplace, recreating, etc. And supported decision-making, wherever possible, is very important. And certainly on a day-to-day basis, very, very obscure, but very important, is the promotion of healthy lifestyles for our individuals. Indulge me for a quick review from Biology 101. We tend to mix the terms germs, bacteria, viruses, and infections. The more you know, the easier it is to understand the strategies and treatment that you will be expected to support. Germs and bacteria can be used interchangeably. Infections are the result of either bacteria or viruses trying to harm or destroy their targets. The major difference between a bacteria and a virus is their structure and size. Bacteria are extremely complex, whereas viruses are very simple. A bacterium, which is the single term for one bacteria, has a cell wall around the outside. Inside the bacterium is filled with all sorts of important structures necessary for life, including a genetic code. Genetic codes are the building blocks from which all living things are made, either DNA or RNA, both of which are specialized acids. On the other hand, a virus is an outer envelope filled with genetic code. That's it. There are no additional structures on the inside. Size-wise, bacteria are really big in comparison to viruses. An average bacterium is 1,000 nanometers long. On the other hand, the largest virus is only 250 nanometers long, and most viruses tend to be much smaller. Don't worry about how big is a nanometer. You need specialized microscopes to see bacteria and viruses. So if you imagine a bacterium as the size of a school bus, then the largest virus would be the size of a motorcycle, and most viruses would be the size of a skateboard. Bacterial and viral infections have many things in common. Both types of infections are caused by microbes, bacterium and viruses, respectively, and spread by things such as coughing and sneezing, contact with infected people, especially through kissing and sex, contact with contaminated surfaces, food and water, contact with infected creatures, including pets, livestock, and insects such as fleas and ticks. Microbes can also cause acute infections, which are short-lived, chronic infections, which can last for months, weeks, or a lifetime, and latent infections, which may not cause symptoms at first, but can reactivate over a period of months and years. Most importantly, bacterial and viral infections can cause mild, moderate, and severe diseases. Bacteria are single-cell microorganisms that exist in abundance in both living hosts and in all areas of the planet, including soil and water. By their nature, they can be either good, beneficial, or bad, harmful to the health of plants, humans, and other animals that come into contact with them. A virus is acellular, has no cell structure, and requires a living host to survive. It causes illnesses in its host, which causes an immune response. Bacteria are alive. While scientists are not sure if viruses are living or non-living, in general, they are considered to be non-living. Infections caused by harmful bacteria can almost always be cured with antibiotics. While some viruses can be vaccinated against, most, such as HIV and the viruses which cause the common cold, are incurable, even if their symptoms can be treated, meaning the living host must have a strong enough immune system to survive the infection. Viruses are the smallest and simplest life form known. They are 10 to 100 times smaller than bacteria. The biggest difference between viruses and bacteria is that viruses must have a living host, like a plant or animal, to multiply, while most bacteria can grow on non-living surfaces. Bacteria are intercellular organisms. They live in between cells, whereas viruses are intracellular organisms. They infiltrate the host cell and live inside the cell. They change the host cell's genetic material from its normal function to producing the virus itself. There are some useful bacteria, but all viruses are harmful. Antibiotics cannot kill viruses, but can kill most bacteria, with the exception of what we call gram-negative bacteria. An example of a disease caused by bacteria is strep throat, and an example of an affliction caused by the virus is the flu. Bacterial and viral infections can cause similar symptoms, such as coughing and sneezing, fever, inflammation, vomiting, diarrhea, fatigue, and cramping, all of which are always the immune system trying to rid the body of infectious organisms. But bacterial and viral infections are dissimilar in many other important respects, most of them due to the organism's structural differences and the way they respond to medications. This presentation came about because of the news, the scary news about a threat from a virus, the coronavirus, and that there is an outbreak of this virus. And while the news, at least the real facts about the virus, are cause for understanding it and preparing for it, the use of the term outbreak means lots of different things to people. And so we should get a better understanding of the word and the family of terms that come under the umbrella term of outbreak. So before you have visions of a zombie outbreak, a zombie apocalypse, take a deep breath and get a better appreciation of how diseases are spread, and as a result of that understanding, how they may be contained and minimized. An endemic disease is a disease that is always present in a certain population or region. One of the most talked about endemic diseases is malaria. The CDC estimates that about half of the world's population live in areas where they are at risk of malarial infection. It is called endemic in large parts of Africa, as well as some areas of South America. Endemic diseases are often confused with epidemics. However, an epidemic refers to an outbreak of a disease. An epidemic occurs when a disease is spreading through one or more populations. In contrast, the endemic disease is one that is constantly present in a group or geographic area. Pandemics are worldwide epidemics. Under certain circumstances, an epidemic can lead to a disease becoming endemic. And while we expect and hope that the coronavirus will be controlled, and by understanding it, that will lead to its control, we also have to respect how diseases can sometimes overwhelm us, at least for a period of time. The Centers for Disease Control and Prevention has confirmed an infection with the virus that causes COVID-19 in California in a person who repeatedly and reportedly did not have relevant travel history or exposure to another known patient with COVID-19. At this time, the patient's exposure is unknown. It's possible that this could be an instance of what's called community spread. Community spread means spread of an illness for which the source of infection is unknown. It's also possible, however, that the patient may have been exposed to a return traveler who was infected. Throughout history, millions of people have died of diseases such as bubonic plague or the Black Death, which is caused by Yersinia pestis bacteria, and smallpox, which is caused by the variola virus. In recent times, viral infections have been responsible for two major pandemics: the 1918-1919 Spanish flu epidemic that killed 20 to 40 million people, and the ongoing HIV/AIDS epidemic that killed an estimated 1.5 million people worldwide in 2013 alone. So what exactly is this coronavirus? With the sudden news about coronavirus, one would think this is a new virus that either came out of a black hole in the universe or was released from some bioterrorist lab aimed to destroy the human race. And there are certainly those who thrive on alarmist and end of life as we know it stories. But what exactly are the facts? The coronavirus was first discovered in the 1960s, and it's part of a long existing family of viruses. The most recent common ancestor of all coronaviruses has been placed at about 8,000 BC. Variants of the virus have been found in birds and bats. The name coronavirus is derived from the Latin corona, meaning crown or halo. The name refers to the characteristic appearance of the projections on the top of the virus that create an image reminiscent of a crown or of a solar corona. In humans, coronaviruses cause respiratory tract infections that are typically mild, such as the common cold. There are rarer forms such as SARS, MERS, and the present COVID-19 that can be lethal. As of now, there are no vaccines or antiviral drugs to prevent or treat human coronavirus infections. Coronaviruses are believed to cause 15 to 30% of all common colds in adults and children. Myths abound about the coronavirus, and basically they are as dangerous as having no information at all. So let's separate the fact from the fiction. So one myth, getting the coronavirus is a death sentence. Based on the data that is coming out, it seems to be a mild type of viral infection. The fatality rate is far vast. The majority in people is very, very low. Those who die are the sickest. They're in the hospital already. So even those in the hospital have probably a 98% chance of surviving. So it's not a death sentence. Those with the biggest risks are elderly, having pre-existing conditions, and have provided low or incompetent immune systems. The other myth is that it's the most dangerous virus. That is not true. There are a number of different viruses out there in the world. So let's just compare it to another type of virus. So you have the Ebola virus disease, which has a much higher fatality rate associated with it. I think the official count is now 6,000 recoveries. One of the funny things is that we don't usually report recoveries when someone is discharged from the hospital. So with all those recoveries, probably there are many, many more on the way as well. Another myth basically is wearing a mask will protect me from the virus. A lot of people like to think so, and of course a mask gives you a sense of security, but it's a false sense of security. The problem is that people who wear these masks usually don't wear them properly, nor are the masks that they're using basically effective. They've never really been trained to properly select a good mask. They may not know what kind of mask to wear. There are two types of masks. One, the simple or surgical mask that you see in the general population wearing. And then there's another type of mask that healthcare workers wear. It's called the N95 mask, and it's a respirator, and is able to filter particles that are airborne with over 95% efficiency. And the one that healthcare workers wear, they have to go through what we call fit testing, and to make sure that they have a perfect seal. People who may think they want to wear an N95 find it very uncomfortable after a while. So even if it's well fit, it's then especially hard to breathe through. The mask is really for those that are infected with the actual coronavirus, not so much for a healthy individual. Another myth is that the coronavirus came from bat soup. That is absolutely not correct. So what we know about the current coronavirus disease is that it started in Wuhan in China, in a wet market where there's a number of different animals there. So there's a couple of different speculations out there, but not from somebody obviously consuming bat soup. What we do know, obviously, is that once you actually get the coronavirus disease, the form of transmission is obviously through droplet spread. So coming in contact with somebody that is sick with the coronavirus, close contact with them, or contact with their droplets right shortly after. Closing the borders will stop the spread of the virus. These types of respiratory viruses, they don't respect borders as we know them. And it's not the fault of a government that this type of outbreak is starting or spreading. It's just the nature of the virus itself. Travel bans historically have proven not to be very effective. In fact, it seems that it was the opposite. They cause more fear and make more chaos. People are reluctant to actually come forward with actually reporting that they had the illness. A lot of it is perception, and with travel bans, a lot of it is political. I hate to say it, but politicians like to do that because it gives the appearance of doing something, but it is often very counterproductive. Another myth is the virus only affects older people. That is kind of half true. It affects everybody, even children. The older people, however, are the ones who are most likely to have severe disease or more serious disease. And even the older people will probably not even be that sick. People with heart disease, respiratory disease, and diabetes are at higher risk. The coronavirus is the same as SARS. So the coronavirus is in the same family as SARS. It's a coronavirus disease. There are two known variants and now 3 coronaviruses known to cause more severe infections in humans. SARS is one of them. MERS, which is Middle East Respiratory Syndrome, is another one. And now the coronavirus disease that just started, obviously. SARS was more severe in terms of the fatality rate that was reported. So it's about 10% versus with the coronavirus, which we're right seeing now is about 1 to 2%, but it's still too early really to tell. This one is different. This spreads a lot more like the flu, but there are so many cases simply because it spreads so well, so many more people can easily get infected. Large numbers of death doesn't necessarily mean that it's a very lethal virus. It just means that a lot of people have been getting it, and some of them unfortunately died. And let's take a look at the seasonal flu. Seasonal flu this year started in October, and the Centers for Disease Control and Prevention are already reporting over 10,000 deaths related to seasonal flu. 20 million Americans being infected. So let's just put things into context. Another myth is that my pet could give me the virus. We haven't seen any cases where pets are transmitting the virus to their owners. You're more likely to give it to your pet than the other way around. Another myth is that the coronavirus was deliberately created or released. Most pathologists say this is giving humans a little bit too much credit. We basically had 3 coronaviruses in 3 decades, but we know that there are a lot of them in nature that look exactly like SARS, and this one doesn't look any special. Infectious diseases can be caused by a number of different things. Obviously, they're natural in the environment. It could be due to obviously climate change, ecological factors, agricultural factors, and human behavior. And these are constantly happening around us. So outbreaks are inevitable. It could be very surprising that anyone would have figured out a way to create it. We still are way behind nature in being able to create poisonous and deleterious viruses. Another myth is antibiotics prevent and treat the virus. Viruses and bacteria are 2 different microbes, so we would use antibiotics for bacteria. For viruses, we use antiviral medications. And so, for example, with seasonal flu, that's a virus. And so one of the ways that we can treat or alleviate some of the symptoms is by giving Tamiflu. That's an antiviral medication. So antibiotics in this context for this virus do not work unless you have secondary infections that are bacterial in nature. This is a very common misconception. There are a couple of drugs now that are experimental, but they're in the development stage, as is a vaccine, that are showing promise against this particular virus. The three major symptoms are fever, cough, and shortness of breath. The symptoms of most coronaviruses are similar to any other upper respiratory infection, including running nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus. You could get lab tests, including nose and throat cultures and blood work, to find out whether your cold was caused by a coronavirus. The tests wouldn't change how you treat your symptoms, which typically go away in a few days. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe, and your lungs, it can cause pneumonia, especially in older people, people with heart disease, or people with weakened immune systems. There are no vaccines for coronavirus. To help prevent a coronavirus infection, do the same things you do to avoid the common cold. Wash your hands thoroughly with soap and warm water, or with an alcohol-based hand sanitizer. Keep your hands and fingers away from your eyes, nose, and mouth. Avoid close contact with people who are infected. Avoid holding hands, high-fiving, and handshaking. You treat a coronavirus infection the same way you treat a cold. Get plenty of rest, drink fluids, take over-the-counter medicines for a sore throat and fever. Don't give aspirin, obviously, to children or teens younger than 19. Use ibuprofen or acetaminophen instead. A humidifier or steamy shower can also help ease a sore and scratchy throat. We're talking about supportive treatments. Even when a coronavirus causes MERS or SARS in other countries, this kind of the coronavirus infection common in the US isn't a serious threat for an otherwise healthy adult. If you get sick, treat your symptoms and contact a doctor if they get worse or don't go away. People with diabetes or heart disease are known to be more at risk from coronavirus. The common risk factor is the lung, because with both types of patients, it is that organ which is likely to be damaged by the coronavirus. Their poor underlying health means that they are in greater danger of suffering serious medical harm from COVID-19 than people with good health. The coronavirus causes an infection of the lungs, or pneumonia. When the lungs get an infection, any kind of pneumonia, not just coronavirus, the air spaces fill up with fluid caused by the inflammation. So the body has to work harder to get oxygen into the blood. The heart and the lungs work as a closely integrated team. So when there is a pneumonia, the heart has to work harder. And so obviously, if there is a pre-existing heart disease, that puts extra strain on the heart. This doesn't mean that people with heart disease are more likely to contract the coronavirus. It just means that those folks are more likely to have complications once they get it. People who have fatty buildups or plaques in their arteries would be at risk of having a heart attack because viral illnesses similar to COVID-19 can destabilize those plaques, which can then block an artery leading to the heart. Diabetics with either type 1 or type 2 are at risk from COVID-19 for similar reasons. Patients with diabetes often have complications involving the heart, but also the kidneys, and in the same way, any extra strain on the body from the infection can cause secondary problems in those organs. Furthermore, we know that diabetics' immune systems are not quite as good as fighting infections as non-diabetics. The risk to patients in both groups depends on each person's health, such as how long they have had their illnesses, how long they suffer complications, and any other conditions that they have as well, such as a breathing problem. But case fatality rates, the proportion of people with an illness who die, show that those over 65 are 5 times more likely to die than those in the lowest risk groups. And in general terms, older people are the likeliest to have underlying health disorders like these. Individuals with intellectual and developmental disabilities could be at greater risk for complications from the coronavirus because many of their co-occurring conditions impact on their immune system. What people have unfortunately died from coronavirus, it's important to put things into perspective and not panic, not to expect that this is a doomsday event or think you are helpless in providing any protection. One of the worst days so far for coronavirus was the 10th of February. On that day, 108 persons in China died of the coronavirus. But to put things into vision, on the same day, 26,283 people died of cancer. 24,641 people died of heart disease. 4,300 people died of diabetes. And on that day, suicide, unfortunately, took more lives than the virus did by 28 times. Moreover, mosquitoes killed 2,740 people every day, and humans kill 1,300 fellow humans every day, and snakes kill 137 people every day. So let's take a deep breath and wash your hands, and let's get prepared. Staying calm is not the same as remaining complacent. What we know of as of today, Tuesday, March 10th, there are 423 total cases in the United States, with 19 total deaths. 35 states in the United States are causing cases. Travel-related spread is 72 people. Person-to-person spread is 29 people, and 322 cases are still under investigation. No one under the age of 9 has developed the virus. The CDC believes that the outbreak could persist in the United States into next year, but that is speculation. The virus could eventually become part of the natural viral environment, just like the common flu that we deal with every single year. Here are the guidelines from the CDC for best practices. Obviously, we want you to wash your hands often with soap and water for at least 20 seconds. There's a mythology that you need to do this with hot water. It doesn't matter whether or not you use hot or cold water. It's the mechanical agitation that works. Give you a reference point for 20 seconds. They tell you while you're washing your hands to sing the happy birthday tune twice. Obviously, avoid touching your eyes, nose, and mouth, because those are the portals where the viruses can enter. And avoid close contact with people who are sick. We speculate that the disease spread basically is a droplet infection that can go about 6 feet. But obviously, it's more like a shotgun than it is a high caliber straight shot. We want you to stay at home when you're sick. Cover your cough or sneeze, which basically we have been telling you for the last decade. And clean and disinfect frequently touched objects and surfaces. And that could be tables, and that could be sinks, and that could be light switches, and basically that could be knobs, and that could be keyboards, etc. So here are some additional concerns for viral disease control at community group homes for individuals with intellectual and developmental disabilities. Agencies should maintain flexible policies that permit employees to stay home to care for a sick family member. Employees should be aware that more employees may need to stay at home to care for sick children or either sick family members than is usual. Strictly adhering to days off, sick days, personal days, etc., need to be reconsidered in any height of an emergency. Adherence to strict regulated staff to individual rations should be relaxed during any crisis. DSPs with no family obligations of their own should not be encouraged to play hero and show up to work if they are not feeling well. Agencies should have available emergency planning policies and protocols unique to their operation. Ensure that the emergency plans are based on common sense preventative actions and that they are well known by the staff. Group homes should be well stocked with water, food, sanitary supplies, communication devices, power generators, medication, and related supplies needed for daily activities. The same type of preparation for a natural disaster. DSP should be aware of community resources for crisis intervention. DSP should have access to medical passports of all the individuals they are responsible for. Perform routine environmental cleaning, surfaces, doorknobs, light switches, countertops. Provide disposable wipes. Emphasize hand washing techniques, cough delivery to both staff and individuals. Again, appreciate that the coronavirus has a 6-foot droplet spray distance before it dissipates. DSPs need to have access to the telephone numbers of the families, conservatives, decision makers related to the individuals they support. Take care of the emotional health of the individuals you support. People with IDDD have an intuitive sense of concern and anxiety when routines are disrupted. Information is key, but it has a double-edged sword. It needs to come from a reliable, trusted, and science-based source. So while you may hear things in the laundromat, or people at the next table at Starbucks or McDonald's, on late night TV, or from your brother-in-law, you can't use that information to conclude things, make plans, or educate others. Information that is inaccurate, false, unreliable, or speculative is not helpful and could in fact be dangerous. Bad information is in many ways worse than no information. So get your information from respected sources, but always use your best judgment. Obviously, the CDC, the National Institutes of Health, and the World Health Organization are 3 of the most well-known reliable sources, but also the Administration for Community Living, as well as your local state health departments, are also very reliable sources. This is probably one of the most important roles that the DSP plays in the fight against coronavirus. It's virtually impossible to escape the news about the coronavirus scare, and I use the term scare because that seems to constitute the bulk and nature of the current news. It should not be unexpected that the individuals we support would not understand that, quote, something is going on. They are intuitive when it comes to changing routines. People's emotions, regardless of their cognitive level, feed off the emotions of others. It therefore falls on the DSPs to educate the individuals they support. For that reason, it is important for DSPs to keep up to date on the news so that they can answer any questions to the extent possible. Questions need to be answered without falling into the pit of creating any undue anxiety. Being informed and being anxious are two different things. DSPs should tailor their approach to the individuals depending on their awareness, ability to understand, ability to process information, and past behavior relating to anxiety and fear. This obviously requires the DSP, as in every teaching moment, to know the individual. Does more information help them cope, or does more information make them anxious? DSP should try to find out what it is that is making them anxious and assure them that everything that can be done to protect them will be done. Also, don't make any false promises. If the DSP can recall a past situation where they were anxious about something and the DSPs helped them get through it, it might be a great reminder that things are typically not that big a deal and that they will get through this together, just like in the past. DSPs might want to turn off the TV news if they are showing people being quarantined, hooked up to respirators in large crowds wearing masks and isolation suits. DSPs should be encouraging their individuals to be proactive in their own protection. So reminding them to wash their hands, use hand sanitizer, cover their coughs and sneezes, and help with cleaning agents on surfaces. Regardless of someone's age or intellect, knowing there's something we can do makes us feel less powerless. DSPs should do what DSPs do best, be constantly vigilant to any changes in their behavior, character, or rituals that may announce an extreme response to their surroundings. Changes in appetite, sleep patterns, bowel habits, socialization, self-isolation, and changes in their frustration threshold are clues for concern and should be brought to the attention of their healthcare providers. Important information. Being guided by reliable information is your best plan of action. A positive attitude is the psychological and emotional equivalent of hand washing. Both have been proven to be important components of a multi-tiered program of protection. Rest assured that there will be another viral, bacterial, and environmental threat in the future, and that the DSP will play an important and critical role in protecting the individuals that represent our most vulnerable population. Remember that this important information regarding coronavirus is intended for the DSPs for use in their community, their own homes, and the group home. The best preparation for tomorrow is doing your best. To me as a physician, DSP will always stand for the doctor's special partners. Thank you and best of luck.
Thank you, Dr. Rader. I think that the information that you provided is going to go a long way in helping direct support professionals, and I hope helping the people that they support understand the facts of the coronavirus. As you mentioned, prevention is key, washing hands is key, preparation is key. And as you were speaking, I can't help but to think about the 15 NADSP competency areas that direct support professionals practice every day on their job. But specifically when it comes to working with people and preventing this virus, promoting health and wellness, relying on their assessment skills, their assessment and discovery skills, crisis prevention and intervention, of course, documentation. DSPs are already doing these. I think right now we need to have a heightened awareness of all of their skills. And I think the information that you gave is going to be invaluable. I'd like to ask everybody who's joined us today to please feel free to share this webinar with your networks, with the people who couldn't join us live today. Again, it will be posted on our website, nadsp.org, and on our Facebook page, and I'm sure we'll send a link out through Twitter as well. Stay calm, stay safe, stay clean, and please do not panic. This is something that we will get through. So again, Dr. Rader, thanks so much, and we'll be in touch with you all. Thank you.